Like sometimes it brings up tears in my eyes because I feel like such a bad mom, right? I had 2 kids under 2, like the 21s apart, and we were dealing with health issues. But my son was literally pausing at breathing. My son had sleep apnea, literally. I was like, wait a minute, are you kidding me? He's 3 years old. How come nobody's picked this up?
Today, we're uncovering the hidden connections between oral health and whole body wellness with Dr. Mandeep Johal. Dr. Johal isn't your average dentist. She's a pioneer in functional airway dentistry, focusing on the intricate links between your mouth and overall health. With expertise in breathing, facial development, and nutrition, Dr. Johal treats families using cutting-edge techniques that go far beyond traditional tooth care. From infant dental development to adult sleep apnea, Dr. Joel's approach considers the entire body. She's here to share her insights on how our mouths impact everything, from our posture to our fertility, and shed light on the intricate connections between oral health and overall well-being that traditional dentistry might not address. Could your dentist be overlooking crucial aspects of your health? Let's find out as we explore the world of functional airway dentistry with Dr. Mandeep Johal. Good afternoon, Dr. Johal. Thank you so much for taking the time to join me this afternoon.
Thank you so much for having me on, Joe.
I'm really excited about this topic because I guess it's the burning question for me and for people listening. Like, what is the difference between a traditional dentist and a functional airway dentist?
So I'm glad you called me a functional airway dentist. We did talk about holistic dentists. And the reason I said let's go more towards functional dentists because there's such a misunderstanding around the term holistic. That's all it is. It's so functional. People associate it with functional medicine, and you also associate it with the whole body approach as well. And really, truly, the main difference really comes down to where traditional dentistry and even medicine in general really focus on treating a symptom. Whereas when you're looking at functional dentistry, you're looking at the whole picture and getting to the root cause.
So everything down to like procedurals, like root canals, are they still part of it, or is it something that would be different?
Yeah. So I mean, a lot of my patients do ask me that. They're like, I have a root canal tooth. Oh my gosh, is it safe? Or, what should I do? Or I was told I need a root canal, Dr. Hall. What should I do? And again, I think we really need to cater treatment for that person. Like you need to evaluate the whole situation. So first question I'll ask is, are you dealing with something systemic? Like, do you have an underlying issue that hasn't been resolved? Because I can give you numerous examples where patients were dealing with issues that they just couldn't resolve and they got the root canal tooth removed, magically gone away. But I can also give you other examples where it had no effect on them. So it's really important that we address patients and look at them as a whole. And if you do choose to get a root canal done, just the precision of how it's done and who does it and what's used to disinfect that root canal is very important because you don't want to leave any bacteria that could travel to the whole body. And full disclosure, I do have a root canal tooth. Okay. So I work my own mentor. I freaked out and I was like, oh my gosh, what should I do? She's like, ozonate it, take care of it. And when you're ready, take it out. But it's not that easy because my sinus is low. And then I'm trying to fix like postural stuff, which we're going to talk about later. And it's a major molar tooth. So, it's not that easy to just replace it, take it out and put a ceramic implant in. Is either. You have to look at the whole picture. It's not
Right.
Dentistry and medicine is not black and white. So you can't just say, well, that's easy, just take it out or don't do it.
Sure. Yeah. And maybe to back up a little bit, like, okay, so most people have been to the dentist, I would hope, at least twice a year, maybe for their cleanings. But,
Yeah.
the typical, you walk in, you might get the fluoride treatment. They scrape the plaque, maybe x-rays once a year, twice a year, whatever the recommendation is. How does the experience differ, if any, between coming to a traditional dentist and your facility?
So let's just say you came in and you brought your child in, for instance. And you're a very natural biohacking, right? So you're looking
Yes.
for, right? So you're looking
Yeah.
for answers. For instance, if your children had cavities, wouldn't you be surprised? You'd be like, wait a minute, Dr. All, we eat healthy. We're doing everything I possibly can. We brush and we floss. But why does my child have cavities? Trust me, it's happened to my colleagues that are chiros, that are naturopaths, and they are embarrassed. So when you're in our chair and we're looking at from a more functional point of view, we have to look at what's your diet like? Right? And your diet's going to be great. I'm not asking about no sugar. You already know that because you're already coming from a place where you understand the importance of nutrition. My thing was this chiropractor, they told me that their son only eats healthy. So I'm like, tell me more about what your son eats. Turned out that he loves nuts. Like that is his thing. He's like this little old man who's only 8, but like just his favorite snack is just nuts. But if you do a deeper dive into nuts, Joe, there is a high content of phytic acid in it. Phytic acid actually binds to a lot of minerals. So this poor kid, like I know he eats well. I'm also looking at nasal breathing because mouth breathing also leads to cavities as well. But for him, it was just a little shift in diet is what we needed to do, and supplementation with other minerals that were binding to these agents. And I'm not saying nuts are bad. I grew up with nuts too, but it's just a little differently. For instance, my grandmother, her nickname's Grandma MD, she would soak all our nuts. So I feel like with a lot of things with Western medicine and Western food, we're taking away from how it was traditionally prepared. I know that's not part of our podcast today. It's holistic dentistry, but diet is a huge, huge part of holistic or functional dentistry. So soaking your nuts is such a great way to get that acid out of there and to get the full nutrients out of it. And so it doesn't bind with other minerals.
I read that too about rice. Is that something similar approach?
Yeah. So, I mean, my grandmother used to soak rice for a very, very long time before they cooked it. But now think about like, we're always in a rush. Everybody's always in a rush. The quick rinse, and rice is dirty. Rice, it not only people are rinsing it just for the dirt, but there's so many other benefits of soaking your rice. Even legumes, any type of beans, sprouting is obviously great, but they were all traditionally soaked. We didn't actually eat a lot of raw food.
I've seen a lot of people that will, well, then I guess you could go back to the microwave minute rice bags, right? Which are probably between the plastic, right? Everything you're getting in there. So someone comes to your office, though, and then is it the evaluation sort of the same way as we might expect in a traditional dentist office?
Yeah, so not only are we screening like the root cause for some symptoms that you might have, but we're also doing what's called a sleep screen. Like I'm screening you for your sleep. And most patients are kind of surprised, like, what does the dentist care about how I sleep? So I'm like, just please fill it out and we'll discuss it. Parents and patients in general, adults are surprised as well. They're like, what do you mean snoring's not normal? I'm like, no, it's common. It's just not normal. You might have sleep disorder breathing. Then I look in their mouth and they have these tiny little arches, tiny little mouths, crowded teeth, adults and children. And you do a deeper dive, like especially for children. Again, I see I see ages from 0 to 100. Okay. But the children is what I feel like get misdiagnosed the most. So when parents are like, why do you care if my child wets their bed? I'm like, there's a huge connection with sleep disordered breathing and bedwetting. And they're like, no, there isn't. And I'm like, well, let's just try. Your child is tongue-tied, has a narrow palate, can't breathe through their nose. So what do you got to lose? Let me try this and see what happens. And magically, it does. It clears up.
Is that sort of like whole body wellness begins with the mouth? Oral health is going to impact the overall health. The things you're talking about, I get it. I'm like, yeah, I'm sold. But why do we think maybe a traditional dentistry, and again, I'm not ragging on any dentist or practice or anything like that, but it seems like, are they missing this or are they just not taught this?
Hey, I'm so glad you asked because for me, it all starts with school, right? So I always make sure I never put down any of my colleagues because we all went to great schools. We all got the same type of education. But what happened for me that was a little different. See, I've been practicing for 15 years though. And 8 years ago, my son, who was around 3 or 4 at that time, had crowded teeth. So here's this little cute kid, never had an issue. My oldest child, great kid, like so loved in like preschool, but he had crowded teeth. So I just asked my colleagues, I'm like, hey, what can we do about this? They're like, oh, Joel, what are you going to put braces on a 3-year-old? I'm like, no, but if he has crowded teeth now, he's not outgrowing it. And then what happened was I did a deeper dive looking into what causes crowded teeth. And maybe that why stems from my upbringing, like my grandparents, my parents, like being very traditional, always natural ways of treating things. So I just looked around and I came across this amazing mentor, Dr. John Mew. I don't know if you heard about mewing. And he was fantastic. He's like, Johal, don't travel all the way to England. I'll send you a colleague of mine down here in California. I was so fortunate to do my mini residency with Dr. Bill Hanks, who was down there. And he taught me, the first thing he said, he didn't even ask me to look at my son's crowded teeth. You know what he asked me? How does his son sleep, Mandeep? I'm like, I have 2 kids at that time. I'm like, I don't know. I shut the door, wake up in the morning and he's amazing. And he's like, no, you have to watch how he sleeps. I'm like, I don't hear anything at nighttime. I'm sure he feels fine. He's like, Mandy, just go in and see how he does. Oh my gosh, show. I had no idea. Like sometimes it brings up tears in my eyes because I feel like such a bad mom, right? I had 2 kids under 2, like the 21s apart, and we were dealing with health issues. But my son was literally pausing at breathing. My son had sleep apnea, literally. I was like, wait a minute, are you kidding me? He's 3 years old. How come nobody's picked this up? We had regular visits with the pediatrician. That's what I thought we were supposed to do. And the pediatrician's like, oh, growth curve. He's doing great. I'm like, okay, he's doing great. But he wasn't. He wasn't actually hitting he wasn't his self. He wasn't what I tell parents is his optimal. Like, what can my son actually be? What's his genetics? What's his optimal growth could be? I couldn't believe that my son wasn't breathing. Then I had to fight to get a referral to an ENT because I could see his tonsils were huge, but the pediatrician thought it was okay because he's still growing. He's a cute kid, no problems. Large adenoids. His adenoid tissues located behind your nasal airway. No wonder my son couldn't breathe through the nose. Totally blocked his nasal pharyngeal airway. I'm like, mind blowing. I'm like, how are we missing this on children? This is their optimal growth time in their life. They're supposed to grow exponentially, and we're missing this. So essentially, sleep apnea, for people that don't know what sleep disorder breathing is or sleep apnea is, you're depriving your body of oxygen. Now imagine doing that to somebody that's supposed to be growing exponentially, what that's doing to them. That's where everything changed for me. I was like, oh my God, how do I get rid of this? What do we do? Work with the natural path. And we're going to talk later on about what's called mild functional therapy. He was also tongue-tied. He didn't breastfeed as well as I wanted him to. And then I learned later on why. He had a really narrow palate. And then it just snowballed from there. Just keep asking the why instead of just giving him straight teeth, right? So yeah, thanks for letting me share that, because if it wasn't for that, and I feel like that's why God gave me the children he did, is for me to constantly keep learning. So that's where my practice grew. And I was like, you know what? If God gave me this ability to help my child, I'm going to help everybody that I possibly can, because more people need to know about this.
Yeah, that's really scary. How did that then lead you to say, okay, this is what I want to kind of do in my practice?
It was challenging because like my son, like my husband and like my family and friends were like, what are you talking about? He's a great kid. So when your child doesn't have problems like behavioral issues or bedwetting issues, or they're not constantly running around with like a snotty nose and they look okay, that's where the challenging part was. But those are the kids that I really wanted to capture, and I realized it's not happening. So I just drew in patients that were struggling with issues with their kids, especially behavioral issues. And sleep affects children a lot differently than it affects you and I, right? You and I, if we have a bad night of sleep, we know what to do. We can have coffee. We can figure out a way. Kids can't. It really affects their behavior. So then a lot of parents are reaching out to me because their child is getting diagnosed with ADHD. And I was like, well, should not be a diagnosis without ruling out sleep. And these kids were not being sent for sleep studies. So then I had to start advocating for the parents and start writing letters to pediatricians, to ENTs, like, please screen them for sleep. Or please take an x-ray and see what their adenoid tissue and tonsils look like. And, before you know it, I'm not an advocate for surgery. Don't get me wrong. If the adenoids and tonsils need to come out, they need to come out. But at least start answering some questions about why a child is the way they are. And then the parents were like, well, what about me? I have poor sleep. Is it too late for me? I'm like, it's never too late. So then that's how it just got word of mouth. So I started helping people that had issues. But now people are starting to understand that, you know what, this child looks just like me. I had issues later on in life. So Dr. Hall, can you help my child now at the age of like 3 and 4? And now it's starting to happen. They're starting to understand that we need to start early instead of waiting. So the paradigm is shifting just very slowly, but it's happening.
Yeah, that's kind of what I was getting at, because I think a lot of people probably hear about it. I mean, even people, when you say, oh, go see a chiropractor, they're like, why? I don't have any back issues, So I think that's kind of my curiosity there about how it kind of expanded and grew, because obviously I think it's great what you're doing. And we talked a little bit offline. You touched on it now about breathing and the facial development. We talked about adolescence. Like, what are you seeing like in patients due to poor breathing habits and facial development that the average parent may not be aware of is going on with their child?
You know what we were talking about earlier,
Yeah,
adolescent ages.
definitely for the breathing. Yes, yes,
Yeah, the
yes.
breathing
Facial.
part. It's a sensitive topic because it's so heartbreaking for me to see like even 18, 19-year-olds now that are getting fillers in their face. Okay, you have to understand, why are they getting fillers? They're getting fillers because their lips are too thin, or they don't have the cheekbones, or they don't have the jawline, but they have straight teeth because guess what? Parents have spent a lot of money, got them straight teeth, but nobody looked at why the teeth were crowded. And if we had addressed why the teeth were crowded, let's take a step back, is because their maxilla, this part, was underdeveloped, meaning it was too far back. When it's too far back, it supports your lips and your lips are going to be thinner, right? And when you're young, you got cheap, like you got the fat pads to help you. But once you pass 30 and 40, that's going to disappear. Then you start getting that sunken in look. You start getting the dark circles that become more prominent. But it's also the jawline that a lot of, I shouldn't just say females, but males too. Remember we talked about mewing earlier too. They're mewing, trying to get that jawline. But what they're not realizing is their upper jaw is so far back that their lower jaw didn't even have the ability to grow because it was trapped, right? Because the upper jaw is so far, the lower jaw is like, wait, I'm stuck here. How do I go further? If you can't go further, you're not going to get that defined jawline. So I see this in my chair. So I was like, if I could just grow those jaws forward for them, it's never too late. I did it for myself, totally changed my jawline. It was not for aesthetic reasons. For me, it was because I started snoring again. But I can do it for literally any age. But this is the age group that means a lot to me because they're starting so young with all this cosmetic. But if we can help them, why not? So we just need to create more awareness about what airway dentists can do for facial development. We can do a lot. We can prevent a lot. And you can age gracefully. So I even treat like 40-year-olds that are like, oh my God, Dr. Johal, I look 10 years younger. I'm like, I know. You're just going to age slowly now because they got the tongue posture up on they got tongue on the roof of the mouth. They're doing the nasal breathing. They got the lip seal and they got that beautiful jawline. Plus, we're going to talk about this later too. I know something you're going to bring up is the posture. It totally, completely changes your posture.
What are some things that the average person may not be aware of that could be very, very, very helpful in these areas that aren't as expensive as we're thinking?
Like mouth tape. So I'm not a big fan of a lot of the mouth tape that's out there, but encouraging nasal breathing with good nasal hygiene is another thing. Like I grew up with, again, is making sure that nasal passage is patent. So neti pot, I know people, it's not part of the normal everyday routine, but it really should be. So nasal breathing and just mouth taping. Like I feel like mouth taping should be readily available to anybody that's buying makeup. Like we talked about that earlier too, is like, hey, you want to wear these fancy products and you want to wear these expensive products for anti-aging, but nasal breathing is anti-aging. It's free and it's very cheap and economical. And so we can teach our patients at a young age that if you nasal breathe, you can literally change the way your face is going to age. Like to me, that's mind-blowing and very, very easy to do. If you're putting creams on at nighttime, and it shouldn't just be for girls, it's guys as well, just put on a little bit of tape. I like to tape, just a note, not on the lips. I always like taping around the lips, but that's another topic for another day why, but it's really important that we do that.
Now, is this strictly when you sleep or you're saying
when you're
throughout the
sleeping
day?
for sure. When you're sleeping for sure. I don't know. A lot of people that like for running and stuff, like at home on the treadmill, I usually just put like a little piece of tape like here. I don't really go all the way across, but I also use a nasal dilator too. So I feel like people that are taping while working out, I would highly encourage a type of nasal dilator that just kind of opens up a nasal passage, or like a breathe right strip. I think we should normalize that in gyms as well. One day. We'll change it.
And again, not super expensive solutions.
No, like for me, one of the first, I remember on this one course that I took, anyways, like a whole body approach. It was a fantastic doctor. And he's like, Mandeep, before I treat you, I need to make sure you can breathe through your nose. I couldn't breathe through my nose, Joe. I had nasal collapse. Nobody ever told me. And I'm like, how am I just finding this out? Back then, I was in my 30s. I'm like, how am I just finding this out in my 30s that I had nasal collapse and deviated septum? How come nobody's ever told me? He gave me a nasal dilator, which I love. I'm not promoting them, but I love. It's called Mute. And it literally just opened up everything. And I swear, I think somebody videotaped it. I should find it. And I was like, oh my God, it's a whole new world. How come I've never been able to breathe like this? And then he goes, well, now I can treat you because now you can breathe better. And I was like, I've lived my whole life like this.
That's great. Yeah. I think that a lot of these solutions, again, a lot of people just don't know that experts like yourself are out there, and I think that's the part of it. That's why I love talking to people like you. And yes, the posture is something I wanted to jump into for sure, because I
Oh,
think that's pretty unexpected to many people listening, like dental health and posture. Could you like elaborate how maybe these dental issues might contribute to problems like maybe neck pains or like even concussions and things I've read?
it's ringing in the ear. Oh my gosh. I would love to. So we were never taught this in dental school at all. But you know what's interesting? I learned this through my osteo colleagues, physical therapists. Physical therapists and most chiros and osteos are taught that your jaw, your TMJ, affects your first cervical, right? Your C1. So whatever your bite is, if it's unstable, you're going to have an unstable C1, your atlas. And I was like, wait, why are we not taught this in school? Because we're literally straightening teeth, we're changing your jaw position. It could be for better or worse if people don't understand the connection. I'm like, why are we not taught this? So, and from PTs, I learned this very quickly. If you know what class 2 is, where the lower jaw sits further back, so they have the lower short third of the receded jawline, that usually affects your center of gravity. So they're taught in school, your center of gravity is going to shift. So these people are more likely to have forward head posture. I was like, oh my God, 100%. That's exactly what I'm seeing in clinic. Class 3 is where you have the underbite, where the lower jaw comes forward. That also affects your center of gravity. And these people are more likely to push their back and their hips tilt forward. It's like, why are we not taught this? This is unbelievable, the connection. So now I do what's called muscle testing. Could be another lecture again. Again, I learned from my colleagues in osteos. So when we're finding the ideal bite position, we're doing something called muscle testing for them to figure out, is this helping them and aligning them with their posture? But the most important thing I want you to get from this is if your tongue sits low and not on the roof of the mouth, you're most likely mouth breathing. And then mouth breathing and forward head posture are 100% linked. Because think of CPR, very simple. When you do CPR, you do head tilt, airway opens up. Your brain's doing that for you automatically, unconsciously all day for you. So if we can get the tongue on the roof of the mouth, get that suction, and we get nasal breathing going, it's automatically going to just push you right up. It helps your posture so much.
Wow, that's fascinating. Yeah.
I start orthodontic treatment as early as 3 years old. And
Okay.
that's usually because their palates are already too small, or they got the underbite, or they got the overbite happening. But most importantly, what I noticed showing these kids is their posture's already off. So they're already getting that tilt. So now I'm working with children, I'm not as young as 3, a little bit older, that are dealing with what's called scoliosis. So
Oh,
scoliosis
oh no, I remember
is
that. Yeah.
huge link with the jaw and scoliosis as well. So now I work collaboratively with a lot of chiros, osteos, craniosacral therapists, because if your bite's off, your jaw's lopsided, it's literally connected to all the cranial bones and it's connected to your spine. And we got to work with the PT sometimes as well, because they have muscles that have been overusing for a while, some muscles that are underused or too weak. So we need to strengthen them. So it's more of a collaborative approach that a lot of practitioners are starting to see with the whole body alignment and starting intervention early.
Are there other things that parents should be watching for that might indicate oral health problems? They're taking them to their pediatrician, they're taking them to their pediatric dentist, but these people could be missing.
Yeah. So when I do assessments on babies, I always look at what their posture's like. And mouth breathing starts at birth. And I know it's a very touchy subject for some people. They'll get really defensive, like my son or child is not mouth breathing, but the mouth is constantly open. The tongue sits here. They're not able to breathe through the nose. So we encourage nasal breathing, nasal hygiene, again, for infants. Get that lip seal, get the tongue on the roof of the mouth. If the tongue is tied, do the release so the tongue can function properly, because proper tongue function is very important for facial development in the earlier years, because that's what actually grows your maxilla. Sippy cups that we use, I didn't know my kids use the wrong sippy cup their whole lives in the beginning. I didn't know it was the wrong or right thing to do. So we encourage patients and we show them the right sippy cups to use, what straws to use, what not to use. So I encourage parents to take their infant to an airway dentist to learn about all these things, because that exponential growth in the first year is huge. So many little things that we can do that are fun and easy to do at home with them, as opposed to trying to do it on a 5-year-old and a 6-year-old, which I did later on, was a lot more work.
I guess when most people think, okay, you go into the dentist office, like I think I mentioned earlier, you get your x-rays and, okay, we're looking for cavities and okay, you're good. But what is your approach? Like, are you using those same type of machines, or are yours like more in depth and looking for more beyond just, the cavity
Right.
x-rays?
I'm located in Canada, so it is a little different, but the standard of care that's changing, like from my colleagues in the US, which I love so much, is a CBCT scan. So a 3D scan, I feel like, should be standard of care, because the stuff that they're catching, that I'm learning from them, it literally blows my mind. It's almost neglect, like if we're not doing it, because they're coming in, remember, I'm a dentist, so head and neck is my scope. So I should be able to do a 3D scan in this area and send it to a radiologist and get a scan to see what we could be missing potentially. And they're catching lots of things. You mentioned cavitations. That's something that they can definitely see in CBCT scans. So we're doing the traditional stuff, x-rays, cleanings, we got a cavity, we got to fill it. But if you got lots of cavities, we're going over on ways to how to remineralize that as well, right? Like we getting to the root cause of why this could be happening. We're using a lot of artificial intelligence. Also, the material that we use to do the work is different as well, right? We talk about biocompatible material, which is really important, because something that works for you may not work for the next patient. They might not be biocompatible with it.
You touched on the ceramic implants earlier. A lot of people don't really realize that they should not be getting the metal.
I taken a few out and I see rust on them. Just saying, kind of scares me a little bit.
Yeah.
Metal, I mean, I'm grateful for medicine, like it's come a long way, but if you have alternatives that are good, that have been used for, oh my gosh, 30 plus years in Europe, okay, yeah, so they haven't brought it here for that long, but they still have research that supports it, right? So
Exactly.
I'm totally, I don't get that. Even mercury, we didn't talk about metal fillings. A lot of patients will ask me, Dr. Hall, what do you think about metal fillings? They're banned in other countries. So just think about that. Why would another country ban them? I want patients to also think for themselves. I also want patients to have a choice. You don't want to push your ideologies on all your patients, because they're coming from different walks of life and different thoughts as well. So I always say, think about that, do some research and come back. And they come back, they're like, please remove the mercury fillings. And when we're removing mercury fillings, we look like astronauts. Like, I don't want that. I don't want that mercury vapor in me either. I don't want to be exposed to that. And I don't want them to be either. So safer ways of removing amalgam is what majority holistic dentists are known for initially. But yeah, mercury fillings is a big one. And I don't know why they're still placing them in children.
Right. Yeah. No, I'm glad you touched on that, because I think that that's coming around a little bit more so in the U.S. with the ceramic, but not as much as, one would hope. Another thing that you touched on earlier too that I wanted to jump into is fertility. Probably news to a lot of people how the mouth and fertility connection could, or is a connection, right? If you don't mind explaining like the link on how you would approach this.
We were talking about how the mouth is a gateway to your body, and how the mouth is literally connected to all your body systems, but it's mostly gum disease. So gum disease affects the body systemically. So first we need to understand that. So when we have gum disease, what do we have? We have inflammation. Your gums are bleeding. What happens when you have inflammation in the body? You release inflammatory markers. Now also think about oxidative stress. Now, that travels through your whole body, because if you bleed here, you got blood everywhere else. And that's what research has found, is that it's the oxidative stress, it's the inflammation that's affecting fertility. In male sperm, mobility, quality, quantity is being affected. And for women, fertility issues, but also preterm birth. So they're finding bacteria that's in here that travels throughout the body all the way down. I'm really surprised actually in my chair how many women come to us that are pregnant and they've been avoiding the dentist. I'm like, why are you avoiding the dentist? Like, you're pregnant, you need to come in. But it's that knowledge that's not out there. Like, your gums should not bleed. They're like, oh, I've been told like it's okay to have bleeding gums when you're pregnant because you're hormonal. No, you're just amplifying underlying issue that we need to address. So what I would do in that situation is we would help them to make sure, like, is the inflammation because of plaque and calculus build up in their mouth? So we will put them on what we call a hygiene program. So go through the hygiene program. And if we don't really notice a lot of change, then we have to do a deeper dive to figure out, okay, their gums are still bleeding. They got no plaque. Things are looking really good orally. We've done a microscope slide as well of their saliva. So the bacteria, I'm not seeing a lot of the damaging bacteria. What's going on? So that's when I do referrals to like a naturopath or somebody else to do a deeper dive of like, is there another underlying systemic issue that's taking place that could be affecting this patient?
Yeah, that makes sense. I guess sort of in the same world of fluoride, right? We're getting that fluoride. We go to the dentist. Do you want the fluoride treatment? It's another $30, whatever it might be. Fluoride in the water, fluoride in the toothpaste. What's the like the Airway Dentistry view on fluoride or alternatives if you aren't for that, but just to sort of set that record straight?
It's another tricky question you're asking because it's very controversial. I see where you're going, Joe. So here's the thing. It's a systemic fluoride that's the biggest issue. So banning fluoride in water, I think that's something that needs to be done because we're getting fluoride from so many other sources and you can't really measure the exact amount of fluoride when you get in the water. So I'm excited for those changes because fluoride's been banned again in a lot of other countries. So it's happening. It's that thing that comes back to choice. Okay. This is really important for patients because we also need to advocate for ourselves and learn is that even in school, we were never really taught that there is an alternative to fluoride. I just want you to know that. We were just taught patient has cavities, got to get that fluoride in there. They got to drink fluoridated water. They're not flossing and brushing. You give them that high dose of fluoride. But we were never taught an alternative. We were never taught why they got cavities in the first place. So I feel like the attention should be, okay, why are we so fixated on fluoride? Why are we not talking about why these communities are actually getting cavities? That's what we should be really talking about. And what are other alternatives they may choose to use? Like hydroxyapatite is a fantastic alternative. That's exactly what our enamels are made out of. And it's incredibly safe to use, right? They've done so much more research on it. Again, it's been around for so long. I just read a review that Japan's been using it for 30, 40 years. And I was like, what? I thought it was just Europe, but Japan's been using it for 30, 40 years. And I was like, this is mind blowing. Like why was this never taught to us in school or mainstream public right now? So that's why, yeah, I hope that helps.
Yeah. No, it does help. It does help. I've seen a couple of people, Europeans mostly, holistic dentists or whatever it might be, recommending a few brands that they do sell in the U.S. that, I've ordered, I use because you never know, right? Like they say that, yes, it does have its place, but are we being fluoridated?
Fluoridated, yeah. No, it's true. And that could be, right? Think about like babies and baby formulas, like you're just adding all that in because there is research that supports, long-term effects and dental fluorosis. We already know if you get too much fluoride, this is what can happen. So how do we control that? Go to Whole Foods and change diets, get people nasal breathing. It's so simple. That's where I feel like a lot of our energy should be put instead of debating. Like people are going to debate about this, oh my gosh, for years.
Right.
Because think about it. How can they not? That if somebody was like, hey, fluoride's great for you, and I got so much research to support it, but now they're being told, oh gosh, you're poisoning people. Like think about how those people are going to feel. So you're always going to have two sides for everything. So I'm just like, I do personally stay away from fluoride myself. My kids are cavity free, but it's not just because brushing and flossing. Diet plays a big role in that as well.
Yeah, exactly. Okay, so talking about kids and even adults, right? There are adults that are into orthodontics. I was going to get into. You're an expert in airway-focused orthodontics. What's like the different? Like, are you into Invisalign, traditional braces? I know, like, because we're talking about metal and the Invisalign. People could say is plastic. Like, what's sort of your perspective on the orthodontics, or maybe there's a case where you might recommend Invisalign over this, depending on the person, or are we considering breathing overall health into how you approach orthodontics?
That's a really great question because I do get that asked a lot about the plastics. And again, just testing them, doing muscle testing is really important to see if this is something their body wants or not. But just so you know, I have a lot of tools in my toolbox. So there's lots of different ways to do airway orthodontics. Clear aligners or Invisalign, it's if you have like minor crowding, right? If you have like a little tooth that's out of place, you want to fix it, I think it's great. But when we're doing, patients are coming to me for airway health because they want better sleep, they're looking for better posture, they're looking for facial changes. We're expanding. We're expanding 3D. We're expanding forward and laterally. And when we do that, I need to use clear aligners or metal braces to start lining those teeth a little bit better. But I also use a different type of appliance called functional appliances. Functional appliances have a great place and they're fantastic. We can start early. I'm starting to use them for adults as well. But functional appliances, again, we talk about Europe a lot, but just have such a great mentor there. And his functional appliance is fantastic, where it's like, hey, Mandeep, get your patient breathing through the nose, fix your posture, and watch the magic happen here. And the jaws and the faces just change magically with this appliance. It's not really magic. It's how the body wants to be, right? When we get the posture right, we get the breathing right. And it's just amazing we can do it, but it can work even quicker for younger children. However, because we live in such a superficial world, that's where clear aligners come in, is like, got to get that straight, perfect teeth. So it's a great option because not everybody wants metal braces, and we have ceramic braces for them as well. But yeah, it's just having different tools in your toolbox is what I stress to parents, because the cost is vast too, right? Airway dentistry is expensive. So that's why I say start earlier. It's a lot cheaper as opposed to starting later on in life.
I also see a lot of like maybe these almost ancient practices, right? Like oil pulling, tongue scraping, right? But coming back in sort of the biohacking communities, are those practices that you recommend? Like, again, obviously there's not a one size fits all, I'm assuming, for every single patient you have, but are those practices like the copper tongue scraping or coconut oil, maybe doing in your teeth a couple times a week? Do they fit into what your sort of expertise is and what you recommend for patients?
Yeah, I mean, that's something I practice personally, something I grew up with personally, because of my background. So tongue scraping and oil pulling has been around for over 5,000 years.
Ayurvedic, yeah, exactly.
Ayurvedic
So,
medicine,
yeah.
exactly. And if you do a deeper dive, I never questioned Grandma MD. I mean, I did when I was little, but I never really questioned her ways because there was always a reason, because they were just told to do and they did it. But when you do a deeper dive, it makes so much sense. The whole idea of doing both of them is you're getting rid of toxins. So they feel that when you're tongue scraping, getting rid of like undigested food, bad bacteria. You don't want that going down and affecting your digestive system, because Ayurvedic medicine is all about your digestive health, like what is good for your body, and getting rid of those toxins is key, and having good oral health. Like you're not going to get any damage by it. And there's no way there's going to be papers that are going to come out and say tongue scraping's bad. Don't do it. It's just so simple and easy to do. Is something I'm teaching my kids to do, which is a little challenging because like, one more thing to do. And I'm like, but it's going to help you. Like for them, I keep it simple. You don't want bad breath. You don't want stinky breath. And brushing your teeth alone isn't going to do that. It's a part of my practice. It's something that I preach to my patients. It's something that my hygienists preach to my patients as well. And it shouldn't just be considered holistic or functional dentists. I feel like we should all be doing it regardless of who you see.
Are those things that you could do every day? Like I do the tongue scraping every day. Some people I've read oil pulling maybe a couple times a week. Some people I hear do it every day before they eat breakfast or something.
Yeah, that's the challenging part. Have you done it for 20 minutes straight? I mean, you need some good
No.
facial strength. That's some good facial oral exercises.
I usually do 10 on the oil pull.
It's hard, but I mean, a couple of times a week is not a bad thing. I've seen people's teeth get whiter, their gums do heal. They just look healthier. And if they're not getting healthier, like again, do a deeper dive. Why are you not getting healthier, right? I do it as much as I can, but I'll be honest with you, I don't do it every day, right?
Yeah.
It's challenging. And to make sure
It
you don't
is.
spit it in the sink, always spit it in the garbage.
Right. You don't want that in the pipes, right?
Try to do it when you're taking your showers. What I usually tell my patients, you're going to jump into the shower, but we're always running too. We're like, gotta go, gotta hurry up. So we forget, but just having that jar in the bathroom, which sounds weird, that's when I remember to do it.
Yeah. Yeah. We've talked about Europe a lot and different countries and continents and things like that. You personally complete hundreds of hours of continuing education this year. Like, are there emerging maybe trends or research in functional airway dentistry that you're most excited about?
Yeah, I'm really excited about airway dentistry coming more like front and center, because now I'm getting more and more parents like reaching me on social media. They're just like, oh my God, my son's mouth breathing or child's mouth breathing. What can I do? Or my husband snores. I've been told that it's bad. I'm like, this makes me so happy, but I also don't want to create fear. So the more research that's coming out, more doctors are lecturing about it, the more awareness there is, more places for patients to go to get the help that they need is what I'm really excited about. And obviously technology is coming around, which I'm really excited about. AI, different ways for us to even test our patients while they're in the chair for like saliva testing, microbial testing, which we can do. Another thing I'm bringing to my clinic, it's vitamin D3 testing, but
Okay.
it's called rapid vitamin D3 testing because vitamin D3 testing is something else I might talk to you about when you're in my chair, is because it's critical for everything: sleep, teeth, health, everything. So just having those kind of things readily available to our patients is kind of exciting.
But people, I think, don't have a Dr. Joel like in their neighborhood. They might have someone that's hundreds of miles away. For those people who are like, I'm really interested in more of this, are there like steps they could start taking today to start incorporating some of the practices you're doing? We mentioned mouth tape, but that could be whatever you think that the person, again, someone that you didn't evaluate, not medical advice kind of thing, but some actionable steps that they could take to sort of better their overall, oral health.
Yeah, so definitely practicing nasal hygiene. So what I usually test first is, hey, can you breathe through your nose for 3 minutes? So do a simple test, see if you can breathe through your nose for 3 minutes. And if it's congested, neti pot, I have like a whole sheet on just nasal hygiene. Like it's that important. So I would promote that on top of mouth taping. So taping, it doesn't have to be, remember, over the lips. It's around the lips, especially for children, or a little piece here, because we want to encourage nasal breathing. And if you need to open up because you're starting the practice, you need to open your mouth and breathe. We touched on tongue scraping, which I think is something very simple and easy to add. But I think the most important thing that we can do, which is very easy, is just our diet. Whole foods, like really break it down to something so simple that could affect us, because we can decrease our inflammation in our body, decrease our cavities, better gut health, just through something simple as diet. It's really that simple. So I think these 3 things, you could start that tomorrow. You can start that today.
Are there resources that people could start learning about online to maybe locate that doctor in their area that would sort of help in this capacity, or any resources that you might recommend for people who want to learn more?
So that's one of the things that I saw, that there isn't really like a website or something they can go to find doctors that are into collaborative care or into airway health. So that's why I created my movement called Heal. So I created a website, which is still in the works, but it's still a little bit there. It's called Heal, 4 leadership.com. And what happens there is you can go in there, type in your location where you're located, type in a symptom that you're looking for, and it's going to populate every type of practitioner that's going to treat that one issue. So if you're like, oh, I have migraines, well, did you know a dentist can help with migraines? Or did you even know what a cranial sacral therapist was? And you're like, they're right down the street from where I live, and I should maybe go check them out. So I just want to open up people's eyes and awareness. So that's why I created that site. I would encourage books, because a lot of my colleagues have written these books. They put a lot of research and time into this. There's tons of books. I'm sure a lot of your viewers have already read Breathe by James Nestor. That's a fantastic book. I had listed a couple more, if I can just share that with you guys, because I really love this one. It's called 6-Foot Tiger, 3-Foot Cage. Take Charge of Your Health by Taking Charge of Your Mouth by Dr. Felix. He's amazing. It makes sense because, again, he's talking about the whole airway approach and making space for the tongue. Jaws, really great mentor of mine, Dr. Sandra Kahn, wrote this book. It's for parents. It's really well written and very easy to understand about what you should be looking at for your children. Why are the jaws and your facial structure so small? Dr. Stephen Lin wrote a great book on the dental diet, which I think everybody should have and really understand. And Sleep Interrupted by Dr. Stephen Park. Like, these are great resources that are well-researched, documented to go to. And, you got to start advocating for your own health. Ultimately, that's what it comes down to.
That's great advice and great resources. Thank you for sharing those, and look forward to your website. How about if people want to connect with you specifically, like your practice, maybe if you're active on any social media, to sort of follow you and follow all of the insights you're sharing?
I'm pretty active on Instagram, so my handle's Dr. Mandeep Johal, and they can contact me there and I can connect them with my clinic. And yeah, I'd love to treat people. I do virtual consults as well, or I'll refer patients to other colleagues that I might know that are in their area, or send them to resources that might help them.
That's great. Yeah, I'll put the links in the show notes for people who, are looking to connect with Dr. Joel. But listen, thank you so much for taking the time this afternoon. It's great to meet you. Great to learn so much about you. I hope to see you in a couple of months here in LA.
Thank you so much for having me, Joe.